Is it your belief, Senator Hagan, that when you voted for health care legislation, you were representing the people of North Carolina?
Yes, I think we need health care reform. When we looked at the fact that in North Carolina, about 10 years ago, people were paying $6,000 for a policy for a family of four. That same policy today is $12,000. In 2016, it's estimated to be $24,000. People's income is not going up that much. We have got to have better access. We've got to have quality care versus quantity care. And there's a lot of good things in that bill. And I think one of my key reasons for supporting health care reform, what I wanted to be sure about, was that it did not increase our federal deficit. I'm very fiscally conservative. This bill is estimated by the Congressional Budget Office, which is an independent, nonpartisan entity, that over the first 10 years it will save $138 billion, and over 20 years it's estimated to save over $1 trillion.
Senator Hagan, there are a lot of people who have enormous distrust in this government, in those numbers, and in your decision-making on this issue. Where in the United States Constitution do you find it an acceptable thing to force anybody to buy anything? And that's the case with this legislation that you voted for.
You know, I've supported health care reform because it's going to lower our deficit. It's going to make health care accessible to people who have lost their job, to people who have a pre-existing condition. We made the health care bill even stronger.
Well, I must tell you, though, that's not responsive to the question. Where in the Constitution is it this way? And but I know we're kind of tight on your time this morning. I do want to make sure that you're invited back. But the idea of the government being able to tell anybody they have to do this is an abomination, and I know that you understand this.
What's happening right now, you individually are paying probably $1,100 a year for people who don't have health insurance, that you're paying that. So what we're trying to do is make it so that people who go to our emergency rooms now, the hospitals, that they do have a form of payment. And I think as people understand this and get better informed, that I think that there will be a lot of this animosity will go away. But listen, it's great talking to you. I think financial literacy is something that every child in North Carolina and certainly around the country will have access to, and hopefully will be better able to understand reading, writing, arithmetic, and understand debt as they go forward in their education.
Senator,
so my Carolina Coffee folks are arriving, so I need to scoot. Thanks. You have
understand.
A great day.
We hope you'll have a chance to call back and discuss this further. Senator Kay Hagan this morning.